People often ask about color vision, and especially how their kids are and how they're doing with their colors. When I see a child for the first time, and especially a boy, I will always check their color vision. Color vision is determined by the number of red, green, and blue cones that enable us to see color. And a certain ratio of those cones is what's called normal color vision. If some of us don't have quite that same ratio of those three cones, then the color vision that they see will be different than what's called the normal color vision. There are two types of color vision deficiency. The most common is a red and green deficiency, and less common is blue-yellow. Blue-yellow tends to be associated with certain medication use or other eye health issues. Red and green is the most common and tends to be a genetic problem. Generally, once color vision deficiencies are identified in children, it really isn't a problem through life. There are certain occupations, however, that people can't go into, such as an electrician or a police officer, because these are professions that require people to be able to differentiate color. Driving with a color deficiency isn't a problem. Generally, all the lights or street signs are set up so that anyone, even with a color deficiency, will be able to identify the different red, green, and yellow colors that are visible. The term color blindness is often used for those people who have problems differentiating color. It's actually not a very good term, because people who are colorblind as such, they definitely do see color. It's just that they have a different ratio of the red, green, and blue cones that are found in their retina, and so they will see colors a slight bit different than someone who has what we call the normal ratio of color vision cones. So they certainly can appreciate colors, they just may not see the same shading or interpret a color the same way that someone with what's called the normal color vision ability would be able to do.